Welcome to the DCAMP's 2014 webinar. This presentation will cover DCAMP's history, welcome day procedures, camp logistics, a typical day at camp programs, preparing for program themes, dealing with homesickness, diabetes management at camp, our staff, registration and forms, and camper family handbooks. Please note this is all general information that is relevant to all our camps across Canada. You can contact your local camp manager or camp coordinator for more specific information, or join us at our camp-specific webinars that will be happening later in the spring. Our history. We've been inspiring independence together since 1953. The Canadian Diabetes Association camping tradition began in 1953 with the opening of Camp Banting in Eastern Ontario. Since then, our camping programs have grown extensively, and the association now operates 12 overnight camps across Canada. Since the beginning, the focus of our camps has been to provide children living with type 1 diabetes with opportunities to enjoy an authentic camp experience while having all of their diabetes needs monitored by a dedicated team of trained medical professionals. Welcome day procedures. We know that all of our families are eager for camp to begin, so we try to make the opening day as smooth and as efficient as possible. Most of our camps use check-in stations for registration. A camp staff member will greet your vehicle, guide you to a designated parking area, and bring you to the welcoming station to check in. At the welcome station, you'll be able to meet the camp coordinator. They'll be there to welcome your family and answer any questions you might have. Medical and dietary staff. So you'll have the opportunity to meet medical and dietary staff. They'll be responsible for your campers' health and dietary needs over the session. You'll be able to ask diabetes and health-related questions to them, and you'll also be able to hand your child's diabetes supplies and other medication directly to the medical staff. At some camps, you're going to hand this medication or diabetes supplies to program staff, but they'll make sure it gets to the health team. You'll also have the opportunity to meet counseling and program staff, so that's everyone from your child's cabin counselor to the arts instructor to the swim instructor. These folks are there to answer any questions and get to know you because they're excited about seeing your campers for the next week, 2 weeks, or 4 weeks. If you are dropping your camper off at DCAMPs, you'll be able to take a mini tour. This will give you a great idea of the areas that your camper will be exploring for the rest of the session. You'll get to see their cabin, where they're going to do all their program activities. So make sure you take us up on the offer of a mini tour. Camp logistics. So the specific logistics are really dependent on the individual camp. Some camps are run in provincial and national parks, some are run at facilities we own, and some are run at rental facilities. So depending on those facility arrangements, sleeping arrangements are going to be slightly differently. The size of cabins, pods, or huts are going to be different, and how the dining hall system, washroom, showers work, and also the packing list will be different. So the specifics around those particular logistical items can be found in the camper family handbooks, and we'll provide information about accessing those online later. In general, though, a little bit of information about our group sizes. Our camp guidelines indicate that 1 staff to 6 campers if you're under the age of 14, or 1 staff to 10 campers if you're over the age of 14. That's not saying that there's only going to be 6 campers in a group, but you might have 10 10-year-olds in a group with 2 staff there. In the dining hall, most camps run using a carb counting system, and some still use meal plans, and some campers that are on meal plans will use them at camp as well. There's always medical and dietary staff around to help out at meals, and then there's also counselors are there to help out as well. All carb counts are provided on all menu items as well. There's always measuring cups there to help campers portion out correctly, and all the meals, carb counts, and portioning is supervised by either dietary staff or a combination of dietary staff and counselors. So a typical day at camp. So this is going to be different depending on the specific camp, but it just gives you a good idea of what camp is generally going to look like. So in the morning, there's going to be a wake up, there's going to be blood glucose monitoring and a flag raising. That'll happen with counselors in the cabin to support campers, answer any questions about what's going to be happening during the day, and supervise the blood glucose monitoring as well. Then we're going to do some insulin and breakfast, have a nutritious meal. All the meals are approved by the registered dietitian and dietetic coordinator at camp, so you can be sure that they're going to be meeting your child's needs, and also meeting any allergy and dietary restriction needs as well. After that, your camper is going to participate in morning program. That can look different depending on the camp and the specific day. So either your camper would be traveling in an entire cabin group to do an activity as a group, or else they'd be signing up for an activity that they're interested in doing themselves. So then that activity would take place with campers from a variety of different cabin groups. Mid-morning, as always, we're going to have a snack to make sure folks get the energy they need for the rest of the day. And then there'll be a second program block in the morning. That's going to be followed by some blood glucose monitoring, potentially cabin cleanup, insulin, and then lunch. Following almost all of our lunch programs at camp, there'll be a rest period. This is going to help your camper get rejuvenated because they're going to be having so much fun and learning so much at camp. So after lunch, it's a little bit of a mirror of the morning program. So there'll be an afternoon program block, snack, another afternoon program block, more blood glucose monitoring, and then insulin and dinner. Typically what happens in the evening is there's an evening program that the entire camp takes part in, whether that's a big game of stones or a big drama activity or a campfire. Usually it's a time for the entire camp to get together and have fun as a group. In the evening, there'll be some form of camp closing ceremony, whether it's a flag lowering or something of the sort, more blood glucose testing, followed by a snack, and then bedtime. So as you'll notice, there are scheduled times for blood glucose monitoring throughout the day. There's also all the staff carry blood glucose monitoring kits, and there's a blood glucose monitoring station set up around camp. So anytime a camper feels low or high or is showing signs and symptoms of being low or high, they're going to be able to test under the supervision of a staff member. And then there's going to be treatment protocols, and also low stations will be spread throughout camp, or also low supplies will be carried by staff. So depending, the specifics are a little different depending on each camp. But if your camper tests low and they're just a little bit low, chances are they're going to be able to treat an activity, make sure their blood sugar comes up, and then get straight back into the activity. If they're outside of what we consider a safe range, they're going to treat and then go to the health center to make sure that their blood sugar is going to come back up to a safe range. Same thing goes if they're testing high. There is blood glucose testing overnight. So that takes place either the counselors or a nighttime blood glucose monitor, or medical staff will go around throughout the night and test the campers' blood sugars. Camp programs. So campers participate in activities that inspire personal growth, encourage team building, and foster an appreciation of the outdoors. Every D camp offers a different array of program options that may include swimming, canoeing, kayaking, sailing, archery, ropes courses, climbing walls, sports, arts and crafts, pottery, drama, biking, earth education, and more. Safety and fun are our camp priorities, and all our camp staff meet or exceed national regulations for certification, as well as Provincial Camping Association guidelines for certification. One of the things we like to do at camp to make sure we're making it a special place is have program themes. So we try to make camp more manageable by incorporating theme days, theme meals, and special events into our programming. They're camp-wide. Everyone, including staff, is involved, and campers are always told about the themes in advance so they can prepare with their cabins. Theme meals can happen at breakfast, lunch, or dinner, and themes can be action-oriented, so singing supper, utensil lunch, bear paw breakfast, or the themes can be costume-oriented, so retro-style breakfast, twin lunch, or superhero dinner. All of those activities and all of the program themes, as we said, are going to be communicated to your campers ahead of time. At some camps, you'll get a list of those before you come to camp, so you have the option of sending costumes or props with your campers. That's completely optional. We always make sure there's enough arts and crafts supplies and costumes around to make everyone feel included. So please don't stress out if you don't have anything to send with your camper. In addition to theme meals, theme days can take place during a morning, afternoon, or full day event. Campers may be divided into teams that compete in camp activities like canoe races, relay races, camp cheers, or other games. Since the sample themes that happen across the country at our different D camps are Ancient Olympics, Lumberjacks versus Voyageurs, Concordia de Terra Day, Super Mario Brothers, or Pokemon theme days. Homesickness is a topic that we often get questions about. There's lots you can do at home to prevent homesickness before campers come to camp. Some of those things are, you can work together as a family to plan and pack. If campers know what clothes they have, what special items they have, like teddy bears or diaries, they're going to feel less anxiety, and the chance of them becoming homesick is going to be less because they're going to feel prepared for camp. Orient your child with dcamps.ca, camping brochures, and pictures from previous summer. Again, you're going to want to help deal with any anxiety that might crop up by letting them know what they're in for, getting them excited about what it looks like, but also being realistic about the fact that they're living in a cabin, there might be a spider, they might have to travel at night with flashlights with the rest of their group, so that you can address any concerns that come up with your child before they get to camp. If they haven't spent a lot of time away from home, it's a good idea to spend practice time away from home. So spending a long weekend at a friend or family's house without you there will help them develop resiliency skills and help prevent homesickness at camp. You want to make sure you talk about what camp will be like before your child leaves. Try not to sugarcoat things. Be realistic about the things that they might find challenging, but also let them know that you believe they can do it, and you're super excited about hearing about all the stories from when they come back to camp. Give your child pre-addressed stamped envelopes and postcards so they can keep you informed about camp activities. So writing home is a great way for campers to tell you what they're excited about, maybe if they're having a bit of a hard time, but it gives them an opportunity to feel like they're still in touch with you while keeping them at camp. Sending mail to camp is a great idea. So you can send mail ahead of time so that it arrives at camp before the campers get there, and you can make sure they get it. This is especially important if your camper is going to a week-long camp. Chances are if you send a letter on Monday, it might not get there by Friday, depending on where it's going and the procedure for us picking up mail. And pack a special item, like I said before, that your camper is going to enjoy, like a teddy bear or a diary or a special book. This is going to be a safety item and help them feel safe when they're at camp. So we use lots of techniques to deal with homesickness while we're at camp. Some of the things we do are staying busy. So we talk to our counselors and staff a lot about how homesickness is most acute before and after meals, right before bed, and at downtime. So any times that the camper's not doing anything and has time to start thinking about home. So we try to keep campers as busy as possible and make sure they're engaged in having fun and not having time to think about the fact that they might be missing home. We're going to encourage them to talk to their counselor. And this is something else you can stress to your campers before they come, that their counselor is always going to be there to listen to them. And if they're having a rough time and being homesick, it's important that they talk to their counselor so that their counselor can help them out however they can. We try to stress with our campers that camp's not your whole life. The session's going to be over really quickly, and that we're really proud of them for staying at camp, sticking through it. Homesickness is real. People do really struggle with it, but we know that campers are strong enough to get through it. We encourage campers to write a letter home. As I said before, this is a great way for them to still feel connected. And we also like to remind campers of all the fun activities that they're doing at camp and give them extra opportunities to do the activities they're really enjoying. One thing I do really want to stress when you're potentially writing letters to camp or talking to your camper about camp is try not to talk about how much you're going to miss them. Of course you're going to miss your campers. They're your children, you love them. But the reality is that telling them how sad you're going to be is just going to make them sad and make them worry about you, and it's going to make homesickness worse. So instead of talking about how much you're going to miss them, tell them how excited you are to hear about them talk about all the great things they're going to do at camp when they return. So say things like, I can't wait to see you in 2 weeks. I know you're going to have so many stories about all the fun you had at camp, and it's going to be amazing, and I can't wait for you to get back. So of course, diabetes management at camp is something that we take very, very seriously. As I mentioned before, there's opportunities for blood glucose monitoring throughout the day. There's some set times that it happens, and then there's also additional supplies provided, so you can be doing blood glucose monitoring whenever needed. In addition to that, campers are tested throughout the night. As I said, either counselors or program staff are testing them throughout the night. Counselors or medical staff are testing them throughout the night. And folks, that can happen in two ways. So If you're particularly worried about your camper's overnight blood sugars, or they have a history of going low or high at night, you can ask for them to be placed on the night list, and then they're going to get checked periodically every night, overnight, every night. So, so that's one way that campers are getting checked throughout the night. Also, there's going to be a blood glucose test that happens right before bedtime or after the younger kids have gone to bed around 11 o'clock. And depending on how they test at that particular time, and depending on how they've been trending throughout the day and in previous days, if they test outside of a certain range, then they're going to get checked every 2 to 3 hours to make sure that they're safe throughout the night. So we keep all our insulin stored in refrigerators to make sure it's good to use. And of course, there's insulin pumps all over our camps. They're a normal part of life at D camps, and the only special consideration we give them is at the waterfront. More often than not, in most cases at most camps, we'll unclip all our pumps, put them in the pump bin, so we're not worried about them getting wet. Even if your pump's waterproof, if there's a crack in the cover, they can be damaged when swimming or canoeing, and then they can clip them back on when they're done their waterfront activity. And all our medical staff have a schedule of where the campers are going to be during the day, so they'll be able to identify if suspending the pump for that hour of swimming is not a good thing, or they'll be able to look at changing the insulin dosages to accommodate for that as well. As I said, there's treatment stations around camp to deal with hypo and hyperglycemia, and medical staff are always on site to help with those situations if they do arise. As I said before, too, most camps are going to be using carb counting as a system, and there's registered dietitians, counseling staff, dietary interns, nutrition students that are always around to help campers measure their food, decide what they're going to eat, and build those really important life skills of carb counting and being able to correctly accommodate the carbs they're eating and taking into account when they're looking at their dosages. Camp staff. So our camp staff are divided into two groups of staff, or medical staff. And in each camp, there's a team of dedicated healthcare professionals that provide diabetes education and management around the clock. This team includes doctors, including pediatric endocrinologists, registered nurses and dietitians, as well as resident student nurses and student dietitians. This on-site team works closely with the campers and counselors to provide the highest level of diabetes care. Together, they provide a support network to help campers manage their diabetes more independently. The other half of the staff team is the counselors and program staff. So we carefully select a dedicated group of young adults that are committed to providing our campers with the highest level of care, safety, and fun. Many staff live with type 1 diabetes themselves and are former campers and graduates of our leadership development program. All staff members have current certifications in first aid, and all waterfront staff are nationally certified lifeguards. All staff members participate in staff training program prior to the start of camp. Additionally, all staff are required to provide a clear criminal reference check and vulnerable sector screening before arriving at camp, and that happens on a yearly basis. So now that you've heard all about camp and you're super excited to register, how do you do that? The best way to do that is to go to our website, which is dcamps.ca, and click on the Register tab. It's going to take you to the registration page. If you're interested in registering for overnight programs, you hit that big red button that says Register Now under Overnight Programs. If you're interested in registering for family camp or detours, then you'd scroll down and find the appropriate Register Now button. So once you hit that Register Now button, you'll be taken to our online camper registration system. So the online camper registration system looks like this. If you're a returning user, so if your camper attended camp last year, then you, in theory, should still be in the system. So you can just sign in using the same email and password used last year. If you've forgotten your email or password from last year, please use the unsure if you have an account, click here button, and don't know your password, click here button to recover that information. This is going to keep you from creating a duplicate account in the system, and which is a great thing because we try to carry over as much information as possible the second year, so that'll help you out from having to type more information in boxes than is needed. If you're a new user, if this is your first time, no problem. Just hit that new user button and then it'll ask you for all the information we're going to need. So following the registration process, you're going to receive a confirmation email. It's going to look like this. Please check your junk email box. It may have gotten put into your junk email box, so check and make sure it's there. And the reason I want you to check is because there's important information in this confirmation email. So attach the confirmation email. There's a consent waiver and release form, and I'll show you an example of what that looks like later. There's also a healthcare provider sign-off form, and I'll show you an example of that as well. And it's also going to have a link to your online account. So if you see at the bottom where it says online account, click here. That's going to take you to your online account page, and I'll show you what that looks like in a second. So this is the healthcare provider sign-off form, which I just mentioned. So this form you need to take to a family doctor or diabetes specialist or nurse practitioner within 6 months prior to the start date of camp. So if your camp's not until August, you're not going to start filling this out in January. You're going to wait to be 6 months from the start date of camp. And that's just to make sure that we have relevant information during the start of camp. Also attached is the consent, release, and waiver form. So you are going to need to sign that for your camper to participate in camp. And below that, there's a media consent and release form. So read it through. If you don't consent to it, then you're going to want to strike through it, so draw a line across it. And if you do sign it, that just says that we're allowed to use pictures of your smiling campers as in promotional material. So on our Facebook page, on our website, potentially in a brochure in the future. And that decision is up to you. And regardless of what you decide on the media consent form, it doesn't impact your ability to participate at camp. So this is the account homepage I was talking about just before now. So on this page, you'll get a list of the medical and other information forms that you're required to fill out before the summer. Once you've filled out a form, it's going to show up as complete. So for example, the Getting to Know You Camper form on this page, once you click on it, it'll take you to another page to fill out the information. And once you submit it, it's going to show up as complete. So you can do these all in one sitting, or you can come back to them later, and you'll know where you left off. Please note that the insulin pump information form only needs to be filled out if your camper is on an insulin pump. If they're using injection therapy, then there's no need to fill out that form. So this is the bottom of the account homepage. There's a link to the online store, which has some awesome merchandise, 2 cats, towels, hoodies, t-shirts, sweatpants, either decamps branded or else branded by your specific camp. So all of the campers get their own t-shirts. So if you're going to Camp Morton, your camper will have their own Camp Morton t-shirt. That's provided free of charge. But if they wanted to get a hoodie or a hat or something else on top of that free t-shirt, then this is where you'd go to make that purchase. When you make the purchase, what happens is that information's saved, and then when your camper comes to camp, they'll get the merchandise they purchased online. If you've applied for the Leadership Development Program, then this is where you find the follow-up form. So your Leadership Development Program applicant will have to submit a resume. So best for them to type it in Word or a text document, and then paste it into the follow-up form document. If you're looking for financial support for our program, so all our programs cost the camp fees are on a 3-tier voluntary payment system, which is basically a sliding scale. So all we do is make suggestions for 3 different fees that you can pay. The cost of camp is something that happens at an administrative level. So no one at camp, including like the counselors, in most cases the camp director, none of the staff, none of the other campers are going to know how much you paid to send your child to camp. So regardless of which of those 3 fees you picked, your camper is going to have the exact same experience. We realize that our camp fees tend to be a bit high, and that's because we have such a need for highly trained both program and medical staff. We recognize that it's not affordable for all families. So there's another application you filled out called the camper application, which is an application for additional financial subsidy if you're not able to meet the lowest suggested price. Again, That's dealt with at an administrative level. No one at camp knows if you've applied for or gotten a campership. So if you need financial support to get your camper to camp, please ask us, because we never want to keep a camper away from camp based on financial or economic reasons. In that application, we're going to ask you basic questions about how many people are in your family, where do you live, what kinds of jobs you have, or if you're employed or not currently employed, and then what your income and your expenses look like for the month, and any additional information, because sometimes income and expenses don't provide the whole picture. What happens is once that's submitted, it goes to one of our camp managers. They look at the application, and either they'll grant the application or they might come back to you with some more questions if the information provided, if they need clarification on it. If you happen to get denied for a campership application the first time, that probably just means that we don't have all the information we need, and we're going to contact you and ask for clarification as well. So if you do get declined, please don't stress out about it too much. Just get in contact with us and provide some additional details, and then we'll reevaluate it. So once you've registered your camper, or also before you've registered your camper if you're interested, you can download camper family handbooks. So these are the handbooks that are going to give you camper-specific information on your camp: how to get there, the drop-off days, the program schedule, what a day looks like, the packing list that's specific to each camp. All that information is included in the camper family handbooks, and they can be found at dcamps.ca/handbooks. They can also be found, a link to it can also be found on the registration page that I showed you in the how to register section. There's just a link that says, have you registered? Here's the link to the camper family handbooks. So that concludes our presentation. If you have any more questions, please feel free to contact us at camps@diabetes.ca, or by calling 1-800-BANTING and asking to speak to the camp manager or the camp registrar. So if you have a registration-related question, ask to speak to the camp registrar. Her name's Natalie, and she's a lovely, lovely person. If you're interested, if you have a question specifically about a specific camp in your area, ask to talk to the camp manager and let them know what province you're interested in or what camp you're interested in if you know, because there is multiple managers across the country, and that'll help make sure that your question is directed to the right person.